Good morning, and thank you for the opportunity to update you on the focused ultrasound treatment of glioblastoma. The treatment of this disease is very difficult for a few reasons. First of all, it's really difficult to ever resect the entire tumor. Sometimes the tumor extends to areas of the brain that are so critical that they can't possibly be resected. In addition, there's microscopic spread of disease infiltrating the normal brain that you can't see on imaging studies and you can't see intraoperatively, so you can't just pluck out all of the cancerous cells. In addition, glioblastomas are very heterogeneous with different cell types having genetic and epigenetic changes that we don't know what the proper treatment is for each of these different variations. Now, focused ultrasound has the potential to enhance the effectiveness of or provide an alternative to the 4 pillars of traditional cancer treatment. Focused ultrasound is going to take the best parts of each of these pillars and try to combine them. So we want to use a targeted approach that's non-invasive and that can open the blood-brain barrier. Now, there's different mechanisms of action of how focused ultrasound can do this. In the table on the left and in the picture on the right, there are 5 different categories, some of which are based on mechanical applications of focused ultrasound, which include histotripsy, nodynamic therapy, blood-brain barrier opening, and radiation sensitization, and some of which use thermal mechanisms of action like hyperthermia and also radiation sensitization. There's also a way that focused ultrasound can immunomodulate the tumor to help our own body attack the disease and help fight it. And I'm going to explain to you how focused ultrasound can do that in a variety of ways. Now let's talk about blood-brain barrier opening first. Now, focused ultrasound has been used in hundreds of clinical trial patients to open the blood-brain barrier safely and reversibly to get drugs into the brain. And it does this by opening the tight junctions to letting, let's say, this blue therapy go into the tumor cells. It also enhances the ability of endothelial cells along the blood-brain barrier to carry drugs into the brain. And it also decreases the pumping of the drugs once they're in the brain back into the circulation so they stay there longer. So this is what happens. We give microbubbles, which are shown here in red. And in the presence of a focused ultrasound beam, the bubbles get bigger and smaller and stretch those tight junctions shown here in yellow. They're like rubber bands. And as they stretch, the purple medicines can get through those tight junctions and into the brain. There are 3 manufacturers that are developing machines that are used in clinical trials right now for blood-brain barrier opening. One is MRI guided, and that's the Exablate system made by Insightec. The other one is a neuro-navigated system where a previously performed MRI scan is loaded into a computer, and in the office setting, that MRI scan helps guide the ultrasound beam to the proper location. And the other device is made by Carthera, which is an implantable focused ultrasound transducer right in the skull, overlying the area that needs to be treated. A recent publication from 2021 demonstrated the ability of focused ultrasound to open the blood-brain barrier and effectively deliver a tracer that's actually a dye into the brain tumor. So this is what they showed. In the area of the tumor that already had blood-brain barrier disruption, the green fluorescent dye got in. In the area of non-enhancing tumor components where the blood-brain barrier is intact, almost no green fluorescent dye got in. But in areas where focused ultrasound opened the blood-brain barrier and enhanced, there was 2 times the amount of delivery of this green fluorescent dye compared to no focused ultrasound alone. So this tells us that we are opening the blood-brain barrier and we can get therapeutics into the brain tumor. There are currently 11 clinical trials exploring different drugs for patients with glioblastoma. Now, the blood-brain barrier opening can not only deliver therapeutics, but also things that can modulate the tumor and make it what we call a cold tumor into a hot tumor. And hot tumors can be treated more effectively. Our own body can recognize the tumor cells and help fight the disease itself. So there are numerous preclinical studies investigating how focused ultrasound can enhance the delivery of some of these agents that can make a cold tumor a hot tumor. In addition, we wanted to explore if focused ultrasound alone can modulate the tumor microenvironment and the immune system. So based on a workshop from 2015, we created a GBM consortium project in 2016, where we convened 6 centers to investigate different focused ultrasound mechanisms of action and how that affected the immune system. And what it showed was that hyperthermia and histotripsy both engage the immune system to help fight the tumor. So this is very exciting research. In a recent report from 2021, blood-brain barrier opening with low-intensity focused ultrasound enhanced the response to immunotherapy in preclinical rat glioma models. So in this red rectangle, you can see that there was enhanced delivery of CAR T cells to the glioblastoma with focused ultrasound compared to without focused ultrasound. And the enhanced delivery of these CAR T cells resulted in improved survival in this animal model. Another mechanism of action is sonodynamic therapy, and this is very interesting. This allows for very precise spatial targeting with no damage to the surrounding normal brain. So there's a substance called 5-ALA, which is shown in green here, which preferentially accumulates in tumor cells, not in the normal brain cells. If you put a focused ultrasound beam in this area, the 5-ALA, which then goes into the cells and changes into protoporphyrin 9, will then create reactive oxygen species, which kills that cell right there. So it's very targeted. And the advantage of using ultrasound is that ultrasound can penetrate deep into the brain. Other people have tried to use light to activate this sonosensitizer and create the reactive oxygen species, but it doesn't penetrate deep enough. So ultrasound is a great sonosensitizer. Numerous preclinical studies have shown that this sonodynamic therapy works. And you can see in these diagrams that the sonodynamic therapy combining focused ultrasound with 5-ALA results in improved tumor suppression compared to either focused ultrasound alone or 5-ALA alone. So we're very excited that there are 2 clinical trials now registered. One is already recruiting in Phoenix and doing sonodynamic therapy in patients with glioblastomas, and one study is about to start in Italy. Radiation sensitization is another mechanism of action of focused ultrasound, and we can hopefully increase the efficacy of radiation therapy and decrease tumor resistance. We also want to show if we can actually decrease the radiation dose needed to thus decrease the side effects. Now, we can use focused ultrasound in a mechanical form or a thermal form to try to sonosensitize these tissues to radiation therapy. So one mechanism of action is shown here, where we use microbubbles along with the presence of a focused ultrasound beam and radiation therapy. The microbubbles cause damage to the endothelium, which releases a substance called ceramide, which helps kill the tumor cells and the endothelial cells. As they die, they turn brown and they cut off the blood supply to the tumor, which also helps killing of the tumor. We are very excited that the first clinical trial for radiation sensitization with focused ultrasound is about to start in Taiwan. Histotripsy is another exciting mechanism of action that may help the treatment of patients with glioblastoma. The advantages are that it's a non-thermal mechanism, so we don't have to worry about skull heating. It's very quick and it's very precise. In fact, in these pictures, you can see how you can actually use the histotripsy mechanism of action almost like a laser beam. You can create the letter M in the brain because it was originated out of the University of Michigan, and you can even create an area very, very well defined like this square deep in the brain. So it's very, very precise in how we target it to potentially kill glioblastomas. Another really interesting way that we can use focused ultrasound is not necessarily for therapeutic application, like I showed you in the previous slides, but for diagnosis. So right now, to determine if there is a glioblastoma there and what type of glioblastoma it is, you need an invasive biopsy with needles into the brain in numerous locations, as shown here. However, this is invasive, carries risk of bleeding and infection. You can't biopsy certain glioblastomas that are in very critical areas of the brain. It's too dangerous. Focal biopsies also miss the inherent tumor heterogeneity that we discussed before, and oftentimes repeated invasive biopsies are needed along the course of treatment and recurrence. Current liquid biopsies, which you may have heard of, where you take a sample of the peripheral blood to detect cancer, is good in other parts of the body outside the brain, like for breast cancer, pancreatic cancer, and colon cancer. But that blood-brain barrier that we're trying to open to get medicines in also precludes different analytes from the tumor to get back into the blood to sample. And this has been proven in clinical studies. But how about if we could get to areas of that tumor, like this part crossing the corpus callosum that I showed you before? How about if we open the blood-brain barrier there and take a look at what's inside that area in the peripheral blood? So the advantage of that focused ultrasound is that we can open the blood-brain barrier to increase the quantity and quality of the analytes. We can target a specific area. We can provide non-invasive longitudinal follow-up and also provide feedback to guide precision medicine. So we're going to try to see if we can not need an invasive biopsy anymore and just do a peripheral blood sample and see what's going on in the brain. So our first clinical trial results from liquid biopsy was published in 2021. It was MR-guided focused ultrasound liquid biopsy, enriches circulating biomarkers in patients with brain tumors. And they showed that there was elevated amounts of cfDNA in the blood after focused ultrasound blood-brain barrier opening compared to before blood-brain barrier opening. So this is very exciting. So we detect increased analytes, and maybe we can see what kind of genetic and epigenetic changes are there and help guide therapies, help decide if the patient is going to have a recurrence before it shows up on imaging studies. So this is a potentially really interesting avenue of research. So in conclusion, I hope you now know how we're trying to fight glioblastomas with focused ultrasound. We had a dedicated focused ultrasound glioblastoma workshop and a focused ultrasound and cancer immunotherapy workshop, both of which concentrated on glioblastomas. And hopefully I've shown you the different mechanisms of action of how focused ultrasound can help fight glioblastomas. So thank you for your time. I also want to acknowledge a huge team at the Focused Ultrasound Foundation who helps make all of this research possible. So thank you.